Wesley Mission and Suicide Prevention Australia released a white paper looking at reduced distress in the community following the COVID-19 pandemic. And we also recorded a webinar. This is a very important issue and it affects many areas of our community and one we must not ignore. Let's take a short clip really from that webinar where I was joined by the Director of Policy and Advocacy, Government Relations and Suicide Prevention Australia, Rebecca Burdick Davies, and also the National Suicide Prevention Advisor to the Prime Minister, Christine Morgan. Our intention is to begin a conversation. It is to make people aware of the issues that are so important in relation to distress in our community, and our intention to seek to reduce that distress in the things that we're about. We've partnered together to produce this paper because we believe it's best talked about together, and a partnership of the kind that we've engaged here is certainly something that's important in the light of the present pandemic across Australia and indeed across our world. So we're talking about COVID-19, obviously, and the effects of that and where we are at this point in time. So Christine, I'm going to ask you, first of all, there's no doubt that this is a watershed event. None of us sat here could have imagined what this is going to be like. What do you think, if I were to ask you the question, how are we faring, do you think?
Oh, look, what a good question. What a good question. And I think it's really relevant to be saying, how are we faring at the moment? Not just go back to, say, February, when it all started, when we were all sort of in this cataclysmic, my goodness, we didn't even know what was happening. So how are we faring? We are faring still in circumstances which give us really heightened anxiety. That anxiety may have shifted a little bit for some of us from being really frightened about our physical security, though some of that's coming back with what's happening at the moment with further restrictions coming back in. It's very much around our economy, it's very much around our livelihood, it's around the future for our children. It's anxiety, Keith, it's really getting to us. And I think that whether we came into this with mental health challenges or not, I think it would be hard to say that any Australian mental health wasn't affected.
You've just mentioned some of those things like economics and issues. I think that's one of the important things, is not just to put this in a box and say we're just going to talk about this as though this is a health issue.
That's right.
Or it's all of it, isn't it?
It's all of it. And I think that was one of the cataclysmic things about it, that whilst it was an illness that was affecting us, the way we had to manage it, the way we had to respond to it, has had this effect across every part of our lives. You know, the way where we live, how we work in those places, how we work with each other, how we interact. I often say, Keith, we came off the bushfires in January, and the palpable lesson from that everybody said was, we want to connect with each other. We want to be really close. You know, we relied on our neighbours, and there we were 2 weeks later, stay away. So just how we even grapple with that is pretty amazing.
And I suppose the question that I just want to conclude before I turn to Rebecca in her particular area is, how do you think we're faring in terms of a new danger that's around? Do you think, have we got a bit too lax about the whole thing?
Look, I don't know if we've got lax. I think we've been reminded that this is not something that we can necessarily eliminate at this stage. I think we're faring in a number of ways. I think that it is certainly, for some people, brought out new depths of resilience, but for many others, it's also brought out, I don't know how to do this. And I have heard from so many people that they have had to reach out for the first time to others. And the way we enable that, the way we respond to that, is so critical in terms of being able to help people find the ways and the strategies to get through.
Rebecca, yours is a different kind of world with the same interest and concern. How do you think we're dealing with it? Do you think we're dealing with it well?
Well, I think it's difficult to give an assessment, because it's just, as Christine mentioned, this is a black swan event. We've never seen a crisis like this before, certainly in my lifetime, but I think within the lifetimes of most Australians now. I mean, obviously there's Australians who've lived through world wars, but this is a pandemic that we haven't seen since the Spanish influenza, which was back in the 20s. But I think There's a lot of things we can be proud of in Australia. So our government, first of all, really sprang into action a lot more quickly than governments internationally. So we had a coordinated public health response, and we can see that with the way that COVID-19 caseloads are being managed. And we had an incredibly coordinated response from a mental health perspective. So we're very privileged to have Christine here to speak with us in this discussion today. We saw the entire government and mental health sector swing into action to ensure that people had a number of different options to go to for support. So I think there's a lot to be proud of in the way that we've responded. But I guess if I reflect on the reasons why we embarked on this report, we can't sort of be static in the way that we've responded to this situation. And I think coming from the perspective of Suicide Prevention Australia, as a national peak body, we thought, well, here's an opportunity to inform government or perhaps inform some of the considerations for government in the next few months. And I think it's these next few months that will be really critical. That was a flavour, I guess, of the research that we reviewed as well from previous pandemics like SARS and H1N1 virus. The first few months of the pandemic, people really came together in the community and came together as one. It's those months afterwards where some people feel the most acute impact, and that's what we want to assist and support.
And we're glad to work with you. And one of the areas that we've been involved in is setting up a whole host of networks from
That's
Wesley
right.
Mission across the country. And one of the things that's certainly true is that people have had to deal with this issue in the locale. They've had to deal with it in isolation, not just an individual isolation,
Yes.
but organisational isolations as well. And so that's been a great, it's good to work with you guys. Do you expect things to change in the coming months?
I wish I had a crystal ball, but of course things will change because, I mean, we've just seen, I think 3 weeks ago when we thought of the title for this report, which is perhaps not as apt as it was when we thought of it, we felt Australia at least was emerging from the pandemic, like New Zealand did. I think New Zealand's basically eliminated COVID-19, and then we've seen the unfortunate situation unfold in Victoria. So I can't really forecast where we're going to head, but I think from the perspective of reducing distress, we can expect, I think quite confidently, this is what our economists are telling us across Australia, we can expect there to be some impacts on business, we can expect there to be impacts on people's jobs, and I think that's a critical concern for Wesley Mission, who we were so proud to partner with on this report, and it's certainly a critical concern for us because we do know there's a relationship between people's well-being and their security of their finances and employment.